So, good morning. Today marks 333 days since our first case. We're in week 47. But unfortunately, 2 more Albany County residents passed away, 2 women in their 80s. We reported losing 4 people over the weekend, a woman in her 40s, a woman in her 80s, and a man and a woman in their 90s. We've lost 334 Albany County residents to COVID-19 now. My condolences and prayers go to the family as always. It's a hard time to lose a loved one regardless of the situation that we're in. We now have 19,111 cases of COVID-19 in Albany County. We have an increase of 75 positive cases since yesterday. That's the lowest we've been since November 29th, which is good. People are doing the right thing. This now brings our 5-day average to 116.4 positive cases. Yesterday was 115. There are currently 2,006 people under mandatory quarantine. Yesterday that number was 2,109. Of the new positive cases, 35 had close contact to a positive case. 3 are healthcare workers. 37 don't have a clear source of infection. As of today, 58,042 people have now completed quarantine. Out of those, 18,120 were positive, which is good. We have a recovery rate from yesterday of 184 new people that have recovered, which is also good. Some other good news, we've only had 3 people, new hospitalizations overnight, which is pretty low, which we're happy about. There are now 97 people currently in the hospital. Yesterday that number was 102, and this is the first time this number has dipped below 100 since December 16th, which is all good news. We have 15 patients currently in the ICU. Yesterday there was 14. The most recent single day percent positive rate, which was February 6th, was 3.5%. As the capital region 7-day average is now below 3.75, which is awesome news. People are wearing their masks, coughing into their arm, cleaning their hands, staying 6 feet apart, and doing the right thing. And hopefully everyone did the right thing for the Super Bowl yesterday. Our testing numbers have been averagely going up, so which is good, and our percent positives are down, all which is good stuff. For those who want to get vaccinated, please check their eligibility. You can do that by going to the state website at 1-833-697-4829. Also know that people with underlying health conditions, February 15th, which will be next week, we can start vaccinating the people in that group, like COPD, heart conditions, cancer. There's a whole list. It's on our website. You can go to the state website and see that whole list that meets that. Some of the questions we got, well, how do you prove it? Do you bring a doctor's note? That would help. Unfortunately, we love to take your word on it, but there are some bad actors out there that will say anything they have to say to get their vaccine and butt the line. So please be patient. Whatever documentation, actually, I'll let Dr. Whalen talk about that, so I'll give that to you in a second. Again, some of the good things I do want to announce today, sports has been an issue, and I stood by Dr. Whalen's decision. It's based on science, not on emotion, not based on votes, it's based on science. And we've been doing this for 11 months, and it will be 11 months this Friday that we hit this milestone of doing this. And I have to say, Dr. Whalen and I have been a great team. We can agree to disagree on different issues, but at the end of the day, it's based on the science and her being a doctor and doing the right thing. As we both are parents of 3 kids, actually we each have 3 kids. Mm-hmm. It's hard, and the amount of kids and families we know that kids are playing sports. I know it's been a hard issue. My poor nephew wants to, he's very upset with me. My sister-in-law is upset with me. My brother-in-law is upset with me. Hey, look it. Part of the job, and I'm not here to make everyone happy. I'm here to make sure the safety and health of the residents that we're in charge of, we're doing our best that we can. But I'll let Dr. Whalen get into it because but as of today, following the science, scrimmages and games can start if the school has submitted everything they need to submit. And I'll let Dr. Whalen talk about what that requires in the letter that she put out, a detailed email. I think it was 2 weeks ago.
I don't know.
I don't know either. It was. I'll let one of the media decide. I don't know if it was last week or 2 weeks ago. I can't remember myself. But you know what? That's a good place to jump off. And please, Dr. Whalen.
Good morning. So yes, in terms of school sports, we have sent very clear requirements to the schools to create plans to ensure that their athletes are safe. We have, to the extent possible, encouraged testing. So for facilities that are able to do that, I would encourage that as well. We do need your plans signed off by your school medical directors and by whatever board is over you, and we will be sending out an attestation later today to all the districts to ensure that that has been done. You know, at this point, the rate is below 4%, but it's really close to 4%. So we also have to consider what happens if the rate starts to go up again. We will continue to follow this. And we will, when we get that communication out today, have a little bit more information on that going forward. I want to continue to talk about the importance of vaccination. You know, we are continuing to have successful vaccination clinics at our Times Union Center. At this point, we have vaccinated with first doses more than 3,400 people. And last week we had our first second dose clinic, which is very exciting. Again, once you get the second dose of the COVID-19 vaccine, it takes about 2 weeks before you develop antibodies. So, you know, people are getting immunized, and we're moving in the right direction. We saw this weekend that there was an opening of criteria for eligibility of the vaccine. This is also good news, but I continue to feel it's essential to get the message across that supply remains limited. We know for this week we are going to be getting 1,100 first doses. If you look at the expanded criteria, you know, there are very broad categories of chronic disease, including obesity, which represents a third of our population. So at this point, we really have to ensure that people know that it is important for you to sign up for vaccine when you can, but also to remain patient. We are hopeful that our supplies will increase, but at this time, we do not have enough vaccine to vaccinate the 1B essential worker population that we were originally charged with vaccinating. So we will have, you know, concerns going forward with supply, and remain hopeful that as supply chains free up nationally, we will have the opportunity to provide more vaccine. This is something that we're very committed to doing, and right now our only limitation is supply. So please be patient. Please understand that we are constrained at the moment by supply, but it is our mission to work with the regional hub and the hospitals and the other local health departments. We know chain pharmacies are likely to get doses this week, but we haven't heard locally where that may be occurring. We know that our pharmacy partners are also looking to increase the amount of doses that they have, so that they can continue to vaccinate the over 65 population. And we know that the vaccine effort at SUNY Albany continues to be a success, with large-scale vaccination supply occurring daily. So we're moving in the right direction. This is all very encouraging news. At the same time, we are seeing our rates continue to decline, which again, I remain cautiously optimistic about. You know, it still is essential for people, even after they're vaccinated, to wear a mask until we can really get to a critical number of people that have been vaccinated. Masking and social distancing will remain incredibly important strategies for infection control. So we ask people to continue with the strategies that you have learned and employed for months during the coming days and weeks and months until we get to a stage where we're able to roll out enough vaccine for us to start those discussions around herd immunity. So, all good indicators at the moment, and we continue to work closely with our partners at the hub, the state health department, and others to ensure that we can do our best to protect the health of the residents of Albany County as we roll out the vaccine.
Dr. Whelan, thank you to you and your team, and especially with the hubs. And I have to tell you, watching the setup at the Times Union Center, when you're doing 800 and then you're doing 400, or on top of that, the people that you're dealing with, it's been unbelievable, and the great feedback. Also with Mohawk Ambulance, I do want to thank the governor personally again for giving the green light for Mohawk. What a great partnership with the county and the city of Albany and Mohawk Ambulance to get out there throughout housing, not just in the city of Albany. We did Watervliet, Green Island, Queens, Ravina, all low-income housing that qualifies for what we're trying to do here. And good lessons learned, with some of the stuff going on. And communications, we kind of found out that Albany Pharmacy has vaccine, and they were just going throughout housing and doing it, and we're not really coordinated with us or with housing. So, but lessons learned, and these are good things to stumble on when you can sit there and figure out, okay, what's the best approach, and Mayor Sheen got everyone together and got them refocused on Saturday, and which is great. So hopefully, as that continues to roll out, it's going to do the right stuff going forward. A couple other things we've been looking at is, unfortunately, the unemployment rate. If you look at it from last year to this year, United States, it was 3.4 unemployment rate for 2019. In December 2020, it was 6.5. In the capital region, most of the jobs that we've lost have been hospitality at 15,000 jobs lost. Manufacturing's been like 2,500, information 400, financial advisor 700, and it breaks it down. These are jobs that have been lost since COVID-19, and it's tough. So please, as the unemployment, I think in New York State unemployment rate was 8.1%, and the national average was 6.5. So, these are things, as things start to open up and businesses come back and people start traveling, we will get there with the hotel and hospitals, or with everything going in the right direction. With the sports, I do want to say to the parents, there is an obligation of the coaches and of the players and everyone else to make sure that you do the right thing, to make sure that we educate the players and the parents. And take your time. They had time to read this. They didn't read it the first time. Hopefully they read it now and get that letter back to the Department of Health so that these kids can play. And unfortunately, as I sit there and say, this is on the schools now and on the sports leagues that they need to fill this out and get it back and get it approved. So when we get that, you got the green light to start playing. So, which is all good stuff. Please continue to use United Way 211 to get information. They're there to help you, to navigate you through the website and everything else. So please use 211 for the people that don't want to go online and get confused. I know COVID-19 has hit our families hard, with many people who out of work, who need help putting food on the table, paying the rent, paying the mortgage, paying the utility bills. It's been a tough time. I know there's been, the people can't be evicted, and which is good, and money relief coming in with this new stimulus package 5, and also the money we received for landlords to take care of both ends. The $9 million we got, and I think the state got like $880 million for landlords, and they got to fall under a certain category and percent and all that other stuff, where they can get bailed out, which is good too, because they got to pay their bills. And if a landlord's not getting rent, guess who they're not paying their taxes to? Albany County, which has a financial impact on us going forward. So it's about partnerships, and the partnerships I have with the legislature and with the legislature Black Caucus, and who's been helping out time and time again. And this is the third year we're holding that MLK food drive, and I've partnered with them as well as the Albany County Legislature before on a variety of things, and this in particular. Last year we collected over 300 pounds of food and donated it to the regional food bank. I'm happy to say we've been partnering again this year But with the pandemic going on, it's forcing us to do things a little bit differently, right? Being creative, like reimagine what the workforce is like, reimagine how we go out and do things and socialize. So this is no different. And I do want to say, please, people, donate to the regional food bank. We have, we'll be hosting a drive-through for food donations, drop-offs this Thursday at 2 different times and locations. And the regional food bank needs our help more now than ever. Every food pantry around the Capital District needs help. They're giving out more food than they've ever given out in the last 10 years. So please, joining me today is Legislator Wanda Willingham, Deputy Chair of the Legislature and member of the Legislative Black Caucus, is here to talk about the program in the Pacific. So Wanda, how are you?
Thank you, Dan. Good morning. This is the 3rd year that the Legislative Black Caucus has hosted the MLK Food Drive to benefit the Regional Food Bank of Northeastern New York. When we started doing this drive, the goal was to honor the legacy of Dr. King, who fought not only for equal rights, but also called for service to fight hunger also. So this year, the food drive takes on a whole new meaning because the need has increased greatly due to COVID-19. Every day, there are food trucks all over the city of Albany distributing food to so many people. It is just unbelievable. But now the food banks are running low on supplies. So we're asking people to help out by donating non-perishable food items on February 11th. So in partnership with the County Executive Dan and our Legislature Chairperson Andrew Joyce, we are going to be holding 2 drive-through donation events on Thursday. So the first event will be in the parking lot of the County Department of Health and Mental Health Complex on South Pearl Street. And that will be from 10 until 12 p.m. And then we'll have another drop-off event at Stewart's on the corner of New Scotland and Whitehall Road from 3 to 5 p.m. People don't even have to get out of their cars. They just drive up and make their donation and leave. But the food drive is desperately in need of canned fruits and vegetables, peanut butter, pasta, rice, soup, canned tuna and chicken, and personal care items like shampoo, soap, and even diapers and wipes. For those who can't make it but still want to participate, the food bank does also accept monetary donations. And so what we need to remember, by helping the food bank, we'll be able to help thousands of families who struggle each day to put a meal on the table. And as Dr. Martin Luther King said, no one's plate should be empty. So please participate and help us in this food drive. Thank you, Dan.
Thank you, Wanda, and thank you for all the work that your Black Caucus has done through this, and working together in a partnership, because we all have to learn from each other and we all have to continue to move forward to get things done for the people of Albany County. But please, if you want to donate non-perishable food items, we'll have a truck in the parking lot at the Health and Mental Health Complex on South Pearl Street this Thursday from 10 a.m. till noon. That's where the old DMV used to be, so the people that are familiar with that. And we will have we'll be accepting donations from 3 p.m. to 5 p.m. at Stewart Shops at 875 New Scotland Avenue in Albany. So you can donate food there too. We encourage people to continue to get tested though. Please go out. Please continue to do the right thing. We'll get through this. The light's at the end of the tunnel. We're getting more vaccine over the next, hopefully, course of the next couple of weeks, and we'll see more and more of that getting out to people and getting shots in people's arms so we can get through this. Please be patient. I know people that want it. I know people that want to get out there. As Dr. Whalen has said time and time again, and myself, wait your turn, and if you don't need it, get it to somebody that does need it over the age of 65, 75. There's still a lot of seniors out there. I see on Facebook a lot of kids that work for grocery stores that are 16, 17, 18 that got the vaccine. That's great, but let's get it to the people that need it with underlying health issues and everything else. So please continue to do the right stuff. We'll get through this. If you want to get tested, as always, if you don't have health insurance, we will pay for it at Whitney Young. For appointment, call 518-465-4771. And also UAlbany, that doesn't charge at all whether you have insurance or not. So University at Albany, if you have transportation, is free. 1-888-364-3065. Go to albanycounty.com. You can see the testing sites, locations, and where your child, if you want a certain age group for children that can be tested. And more importantly than anything else that we have done is the mental health. I know people are struggling. I know kids are struggling. It was obvious when we had that sports protest. I know kids want to get out and be kids. I get it. And we have to do it in a safe way. Please take the time, parents, talk to your children. Talk to them and let them know what's going on. And just look at their point of view. And as I remind everyone, everyone's stress level is different than everyone else. I might be able to take a little, well, I should say this, Wanda Willingham might be able to take a little bit more stress than I can. And I can, Dr. Whalen, you were trained in medical school to take stress, so we're not going to throw you in that category. But again, it doesn't matter. You still, people, we're still parents, we're grandparents, and there's a lot going on in people's lives. So please call. It's available. It's free. It's 7 days a week, 8 a.m. to 5, 518-269-6634. Please call. We're not sending the cops. You're not going to get arrested. We're not there to lock you up. We're there just to help you. Let us help you. Let us do what we can to help you to get through this. Again, please, as always, the feature is available for crime victims. You can go to albanycounty.com. We've got text messaging you can do now. We know our cases, unfortunately, we're seeing more women end up in hospitals than we did in 2019 versus 2020, but they're not reporting it. And neglected children too. It's tough. Teachers are mandatory reporters, so when kids are in schools and teachers see something, they can report it. They're in the trenches. They're on the front line. So all these numbers and statistics have dropped. Same as you'll see with breast cancer, heart disease. That's why I did the thing for the American Heart. Unfortunately, this is overshadowing a lot of other things going on that we need to do, like the food pantry, which the Black Caucus is doing. This goes on regardless if there's a pandemic going on or if not. It's just unfortunately it's hitting us harder now. But this is something, unfortunately, that's here, part of our fabric of our community, the backbone of our community, to make sure families don't go hungry. So please, by all means, call 211 with the United Way, New York State hotline, as always, and we'll get through this. We're almost there. We are almost there. We got to continue to do the right thing. If there's not any questions, be safe out there.